Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Good day, Philippines. You're watching the Business Portal, your gateway to health, beauty, trends, and opportunities. I'm your host, Dr. John Cenica for What's Up, Doc? Yes, and what a nice day, I could say, because we were the program was transferred from 12 o'clock to 1 o'clock. But we have a very cold morning this morning, Dr. Lau. But before anything else, we would like to introduce to you my co-host, an icon in cosmetic surgery, no other than Dr. Ray-RAN Lau. Morning,
good afternoon,
Ray-RAN.
Dr. Cenica.
Yes,
Good
yes.
afternoon to all the televiewers of GNN, especially What's Up,
What's
Doc?
up, Doc? Yes, and you know, we had a very nice topic for this afternoon.
Yes, we
I might
have
say
two topics.
morning, pero it's afternoon.
Medyo nalilito tayo, Dr.
And-
Cenica, kasi
and we're
second segment pa lang natin.
Yeah, we are broadcasting live.
Yes, live tayo.
Okay, in live here in Global News Network. And of course, our topic will be all about health and beauty.
Actually, this is the first time, Dr. Cenica, na sa second segment natin na magde-demo tayo ng mga electronic chair massages.
Yan, ang second segment natin, sabi mo nga, we will be demonstrating yung mga high-tech, no?
Yes, kung ano
High-tech
ba ang health
electronics,
benefits ng mga electronic chair massage.
Kasi ngayon, usong-uso na yung massage eh.
sa mga mall, may binabayaran ka ng
Correct.
15 minutes na magpapamasahe ka.
Right.
Ito, makikita natin mamaya.
Minsan, mura lang din, pero minsan yung 10 minutes or 15 minutes is not enough for
Bitin,
us.
bitin yung
Parang
15
bitin.
minutes.
So ngayon, if you had that at home, medyo mas maganda ang feeling.
So we will discuss that later after the second
yes,
segment.
and of course, for this segment, we will be discussing all about beauty.
Yes.
And we have, I could say, a guest from Janssen Cosmetic Surgery. And he is, I could say, one of the icons also.
Yan, and ayun, kung napapansin nyo po yung, or kung naririnig nyo, yung background music natin kanina.
Yun,
siya po ang
producer at
Yes.
composer din ng music na yon, okay? And he is the National Chancellor of the Philippine Academy of Medical Specialists, I could say, an associate member of the Philippine Academy of Aesthetic Surgery, medical associate of Janssen Cosmetic Surgery, no other than Dr. Ken Dalisay, a Beta Sigman. Okay, good afternoon,
Good
Dr.
afternoon.
Dalisay.
Dr. Cenica, good afternoon, Dr. Lau.
Yes.
It's nice to be back here once again.
Alam mo,
And,
si Dr. Dalisay, ano to eh, showbiz din to eh. Marami itong mga guesting din sa, napaka-busy nito eh.
Yes, oo.
Napakadami niyang guesting, it's all over the television network.
Lahat
eh.
ng networks nag-guest
Makikita mo
po. Very
siya,
familiar
oo.
face, very
And
familiar face.
eventually, siguro, baka maging host na rin to ng WhatsApp Doc, ha?
Thank you,
And,
thank you.
ang projection pala sa TV, eh, talagang artistahin. Ano?
Action
Okay.
star.
Yes, Dr. Dalisay, I know you were a cosmetic surgeon and you did a lot of procedures. Ano ba itong mga coverage ng cosmetic surgery practice? Ano-ano bang mga ginagawa nito, Dr. Dalisay?
So it's basically from head to toe. Any
Okay.
procedures na gumagamit tayo ng knife para doon sa madaling pang unawa ng mga tao, ng layman's, ano?
Yes,
So it's basically from head to toe na any surgical procedure, kino-cover natin yan. Sometimes, ang biro ko pa nga sa mga pasyente is actually parang dagdag bawas. Ano? Yung mga medyo sobra, binabawasan natin. Yung kulang, ino-augment natin.
Actually,
So that's how we do it.
dictum yata ng cosmetic surgery, no? Parang dagdag, it's basic.
Dagdag bawas?
Dagdag bawas. So,
Parang
sobra,
yan,
babawasan.
eleksyon,
Kung
Yes, yes.
kulang, dadagdagan. So, in your practice, Dr. Dalisay, ano ba ang, napapansin mo anong pinaka-most common na mga surgical procedures na pinagagawa ng mga tao?
Well, rhinoplasty or the
Nose
shaping
lift.
of the nose or
still-
nose
it's still-
lift.
Usually sa Orientals, it's very
Yes.
common to have a nose job
It
done.
actually comprises around 75 to 80% of the patients. are
75
having,
to 80% ang
yes.
procedure is nose lift.
Nose
Nose
job,
lift,
yeah.
yeah.
Kasi you know that nose is the center of the face.
And the most projected part of the face.
Correct. Kasi
So,
for the benefit of the patient, I mean of the televiewers, I mean, whenever you look on the face of the person, unknowingly, you are looking on the nose.
Bakit ganun, Dr. Dalisay?
Because as you have said, it's the center of the face,
Yeah.
and it gives the harmony
Correct.
sa kabuuan ng mukha, no? So kung may konting problem diyan, makikita mo na kagad ng imbalance ng features ng face.
By the way, for our televiewers, you can text your messages, and we're broadcasting live here on Global News Network. And our cell phone number is shown in the screen is 0922-891-6761. And please indicate your name
And your location.
or
Yes.
address where you are at right now. And Dr. Lau, mamaya, in
Meron
our
tayong
second
raffle.
segment, we have a,
Dito.
we'll be giving a gift.
Yan,
Ito, itong
Hero
High
Super
Belt
Belt.
Massage.
So, kung sino
Yeah.
po ang magte-text, pipiliin po namin kung sino yung mga mapipili.
Yes.
At magkakaroon po kayo ng prizes. Courtesy of Hero
Hero,
Super Belt.
our guest mamaya, no? We will be promoting, not really promoting, but rather giving some nice products and demonstrate their actual electronic massage or
Yes.
electronic chair massage, okay? And of course, it's a connection with beauty, no? So, but Dr. Dalisa, itong mga massage na to, does it help also in to promote the beauty of a person?
Yes, of course, dahil sa kapag ka-relax ka kasi, sinasabi nga, no, lumalabas yung natural beauty mo, no? So, minsan kapag ka-stressed out ka, nakikita mo naman, tinatawag natin, especially among the youngs, na parang haggard, no?
Yes, yes.
So, pagka nagkaroon ka na ng relaxation, in a way, na-attain mo yung
Saka
natural
it
beauty.
increase the blood circulation,
Exactly.
eh, no? Of course.
Actually, yun ang ginagawa talaga ng massage, ano? Yun ang understanding natin sa medical aspect.
When you say there's an increase in blood circulation, there's more oxygen supply on the tissue. So you make the tissue healthier and looks younger
actually,
and
parang
relaxed.
Everything follows.
Yes,
Kapag magandang circulation,
Para ka
everything
na rin
follows in terms of
nag-exercise ng kaunti, ng light, kasi increase yung circulation mo. And good thing about the chair is pwede mo ilagay sa kwarto mo. Manood
Yes.
ka ng
Oh,
TV,
naku,
kasama
mamaya,
mo ang ba?
si
Mamaya po.
yung
titignan
ating
po natin.
representative from Hero, talaga namang, alam mo, Dr. Dalisay, let's talk about the nose job. You say that it's almost
most common.
75% of the procedure in cosmetic surgery is a nose job or nose lift, particularly nose lifting. Oo. So, ano ba itong nose lifting? I mean, I know, kayong dalawa ni Dr. Lau and Dr. Dalisay talagang very expert in doing a nose lift. How do they do that? I mean, basically.
Well, depending on the surgical requirement of the patient.
Yes.
Meaning, kung ano yung itsura niya, depende sa pangangailangan. As I've said earlier, kung medyo sobra, binibigyan natin ng paraan na bawasan ng konti. At yung kulang naman, ino-augment natin.
Okay.
So, basically, sabi ko nga, reshaping yan. So, kung nagbibigay siya ng hindi balanse sa mukha o yung harmony na sisira niya sa itsura ng isang tao, ibinibase natin dun sa kabuuan para magbigay ng feature na mas aesthetically acceptable.
Have you had any, sorry Dr.
Sige,
Cenica, have you had any patient, Dr. Dalisay, na darating sa clinic, may dala silang picture ng iniidolo nilang artista? Kasi nakita ko kay Dr. Cenica, ito gusto ko picture, gusto
minsan
ko
ganun,
kapuka.
eh,
Naka-experience ka na ba nun, Dr. Dalisay? na-
Very common, very
Yes,
common yan. Especially kapag ka merong mga artista na umaangat yung peak ng career nila. Ang mga pasyente na most of the time, kahit hindi bagay sa kanila,
Basta
pinapaki-
magaya
Yes,
ang-
exactly.
Kasi na-idolize kasi nila yung picture eh. And they thought that ang cosmetic surgery, sabi ko, we're not operating in a computer or in a clay. We are operating in a human tissue. Kasi, we might, I could say no, but we might do a procedure or a shape or ideal nose that you want. It depends upon sa structure ng ilong.
Tsaka kung babagay
Sabi
din
ko nga
sa
sa
kanila.
pasyente ko minsan sabi ko, yung let's say kung ang kotse mo ay napakalaki, mga 8-cylinder at parada mo sa loob ng isang garahe na ang dating
Kasya
kasya lang
lang
yung Volkswagen, hindi ka kasya.
Exactly,
No? So depende rin sa structure ng
So for that matter, naipapaliwanag naman natin sa mga pasyente dahil
Yes.
syempre, first thing first, kaya siya pumunta sa inyo, nandun yung trust niya. No?
Yes.
So gamitin mo yon dahil sa ang i-advise naman natin sa pasyente, yung nakikita na lang talaga nating tama in terms of beauty and of course, hindi mako-compromise din yung health status niya.
Yun,
So,
tama.
napaka-importante
Ito ba,
kung ganun.
Dr. Dalisay, pag ikaw ba nagpagawa ng ilong o nagpa-nose lift, kinakailangan pa i-hospitalize ang pasyente.
Or pwede ka bang umuwi right
Or
after
let's say,
the
ito
procedure?
ba,
Outpatient
ba to?
procedure?
It's a outpatient basis, outpatient
Oh, so
procedure.
pwede po umuwi ang pasyente right after?
Right
It is
after
done
pwede
under what? General anesthesia?
It could be done under local anesthesia
local
or sometimes
anesthesia.
it could be
Gising.
sedated, especially if it's combined with other procedures. But normally, okay na ang local
Local. Ibig
anesthesia.
sabihin ng
Local
local po
anesthesia.
sa mga ating televiewers is gising po ang pasyente
Gising
at
po ang
nakakausap
pasyente,
po ang pasyente. No?
kung paano po ang experience niya sa mga dental clinic.
Same.
Kung nagpapalinis sila, nagpapa-tooth
Bunot ng
extraction.
ngipin. Same with
para
ano,
halos
local
ganun lang
anesthesia.
doon. Nakakapagkwentuhan pa sila, nakakapagsalita.
So para ka lang pumunta ka sa dental clinic, no? Na you
exactly,
undergo a
exactly.
tooth extraction and then after that you can go home immediately after the procedure.
Ang kaibahan naman dito, pag tapos ng procedure sa dentist, lilinis ang ngipin mo, dito naman tatangos ang ilong mo.
Yun.
Yun ang pagkakaiba. Maraming pasyente tayo, Dr. Cenica, na nakikita na
Yeah.
pupunta at may problem because maraming, I could say, na nagpapa-inject ng mga
Oo.
so-called na hindi medical grade material at nagkakaroon ng problem. Ito yung talagang gusto
Usually ano
nating
ba yung
i-address,
mga ano kasi there's some really tama ka
Ang daming
Dr. Lau.
pasyente na
There's some particular patients who came to our clinic and they had this sabi niya nagpa-nose job daw sila.
Yes.
And then yung pala nagpa-inject ng something on their nose and they don't even know na
Kung ano yung material.
what kind of material they're injecting in the nose. But the problem is that some of these unscrupulous person, I can say something, they're not even doctors,
But they say that they are
they're
doctor.
doctor,
Yes.
yung pala, doctor of philosophy lang. No? And then, they inject this kind of material that the patient unknowingly doesn't know that what kind of material they're injected. So when we isolate or remove the material ng particular procedure na yun, we found out that it is a paraffin.
Paraffin or
material.
silicone oil.
Or silicone or not even silicone oil, baka mukhang mineral oil lang
Mineral oil.
Oo. And that's probably, I could say some of the patients who are watching right now who undergone this kind of procedure can relay whatever we are saying right now. And the problem is that this injected material goes on the lateral o sa tagiliran ng ilong at parang lalong lumalapad yung ilong niya. Initially, parang matangos, pero actually after a while. And the thing is, you are just like, this is a warning for patients who undergo injection of the noses, you know. And they're like a walking time bomb. And anytime this material may interact on the tissue of the particular
May cause
patient,
infection.
of course, infection, correct, swelling, and redness, and they come to us. Just like Dr. Dalisay, ano bang ginagawa dito doon sa pag tinanggal na yung mga paraffin material or oil material that's injected, supposed to be, para daw magkaroon ng nose lifting?
Well, depending on the case, ano?
Yes.
Meron kasing, as you have said, the paraffin or wax. No?
Right.
Kapag ka kasi ganyan, usually, i-encapsulate siya ng katawan natin. So meaning, there's ang katawan natin may capacity to para maihiwalay yung foreign body that was being injected inside. So, for that matter, mas maganda pa siya compared to the silicone oil. Kasi ang silicone oil, in a way, I cannot say na parang biointegration siya, pero in a way, nagmi-mix siya. Hindi mo makita talaga kung asa na siya. Pero nagbabago ang texture ng skin. So, doon mo malalaman kung is it silicone oil, is it paraffin, or the other thing na sinabi nyo, Dr. Cenica, na mineral oil. Kung ano man yon, medyo may pagkapamilya yung silicone and mineral oil.
Nabanggit mo kanina, Dr. Dalisa, yung good thing. Hindi naman good thing yung paraffin. Compare lang siguro sa mineral oil.
Yes.
Because pag tinanggal, mas
comparing
ano yun
between two
madidilim
evil
eh.
things.
Yes,
Yeah.
At saka, it's not even fit for human consumption eh. Alam mo yun? These are both industrial grade eh. Hindi siya yung medical grade na material that has to be in the tissue. And the problem is that, makikita mo sa television, nahuhuli nila. Ito ginagawa sa mga parlor,
pupuntahan po kayo sa bahay.
Ginagawa sa bahay, home service, and yung mga...
Well, from the words that came from the mouth of Dr. Lau, na that's not a medical grade material.
Yes,
So
yes.
from there, alam na natin hindi dapat siya
Hindi talaga ideal
inilalagay sa katawan natin. Going back dun sa sinasabi ko na hindi ko na sinasabing good talaga siya. I'm just comparing with the other material. But sinasabi ko lang po yun in terms of dun sa revision.
And there's some
surgery.
even patient who undergone this kind of procedure, surgery, and I even get a plastic material. I know what kind of plastic is that. and then they insert it in the nose, and then eventually makita mo ang sama ng...
Actually, nasisilaw yung mga pasyente, Dr. Dalisay, because number one,
Mura.
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 Yes.
Pagtatanungin mo,
Beware of those mura na procedure.
Yes.
Kasi, one thing more, sasabihin nila, oh, we have, mag-ano pa yan, mag-name names pa yan eh. O ginawa namin si artistang ganyan, ginawa namin si politician na ganyan. Tapos, maniniwala ka naman, tapos home service, sabi na, hindi ho masakit ito, at walang anesthesia, at ito ay ang dami na namin ginawa. And beware of those people.
But the bottom line there is the price, actually.
There is the pride. Don't be...
yes,
don't-
and to add up, ang sinasabi nila, actually, hindi na sila sabing paraffin or oil. Ang sinasabi nila lagi,
Collagen.
Collagen.
Yeah, yun ang
Yun ang
Yun ang
very
mga
common na naririnig natin.
common, ano,
Collagen ang
collagen.
sinasabi nila. So,
At-
doon na-victimize yung mga pasyente na akala nila, yes, collagen to. Nakakaganda ng skin, at the same time, tatangos pa ako. So, yun yung mga pagkakamali po natin na sana wag na
Na
pumawa.
wala man lang silang idea na kung gagamitin talaga collagen, they would cost them so much
Yes,
for a single drop
for
of
1 ml of
collagen.
collagen.
Yes.
It's
Kaya
very
that's why
expensive.
beware of those scrupulous people na bibigyan ka ng home service. Hindi, there's nothing in
Masahe
medicine
lang
as
po ang
home service. Yeah. At mamaya di-discuss natin yan, no? And then, other than nose job, doctor, ano pa mga procedure ba na ginagawa sa cosmetic surgery?
Well,
Most common, the most common.
isa sa mga love natin dahil sa common rin nga siya, no? Ay katulad ng breast augmentation, liposuction. So yun ang mga madalas na nilalapit sa atin. Ano? Among dun sa mga mas maedad ng konti, kumpara dun sa mga usual na pasyente natin, yung mga lifting, no? Yung mga facelift, for example. Although may mga, because of the advent of dun sa mga bagong technology, instead of doing the traditional surgery, meron po din ngayon ng mga,
Medyo bawas
mga
na. Oo.
thread lift, things like that,
Medyo
na iba-ibang
nabawasan
innovation.
ang facelift na surgery because
Yeah.
yun nga sinasabi ni Dr. Dalisay, with the innovation ng mga V-lift, yung ginagawa ni Dr. Cenica, and the machines actually.
There's
Minsan
several machines.
yes,
like-
nag-opt out yung pasyente sa surgery because ayaw nila yung downtime.
Especially for those people na man is no object, kahit babayad lang ulit sila after 2, 3, maybe 4, pagswerte, 5 years,
Yeah.
pagka mabagal ang aging process. So, it doesn't matter so much to them.
That's why there's a lot of procedure right now. We call it in thread lift. These are almost non-invasive. Wherein we just insert a thread on the face of the person and you pull it, and then you can see a significant changes. Wherein the nasolabial fold will be a little bit more shallower in comparison with the
So
previous
instant lift ito,
picture.
Dr. Cenica.
Yeah, it's an instant. You can see in a
And
possible
the
results.
downtime is
The
hindi
downtime
ganun katagal
is
compared to
short. It's a short downtime. And especially, Dr. Dalisay, di ba, minsan yung mga balikbayan, kasi may mga balikbayan pupunta sa Pilipinas, they have only a short
Short,
stay
yes.
of like 2 weeks. So they come to the clinic of Dr. Dalisay and have this kind of treatment. Oh, what can you, ano ba mga significance nito, Dr. Dalisay?
Well, dun sa mga nag-develop ng mga laugh line, for example, nagkakaroon kasi siya ng tinatawag na mechanical pulling effect. No?
Oo.
So, aside from the instant effect right after the procedure, little by little, over time, makikita pa rin niya yung extent mismo ng effect ng
And this is again another
procedure.
Is it an outpatient and you has to become hospitalized?
Another office procedure, meaning outpatient
Outpatient.
basis, right after. Actually, pwedeng hindi na tayo mag-anesthesia. Sometimes kahit yung topical anesthesia lang, or yung
Topicals,
parang
yeah.
kung dun sa mga hindi familiar, ano lang siya, yung parang cream.
Pinapahid lang po.
But sometimes kung medyo hindi naman masyadong mababaw ang pain tolerance ng pasyente, kahit hindi na.
So that's why yung mga downtime, you say downtime, yung pong healing period is less lang no? In comparison
Almost-
with the
almost no downtime,
most
actually.
invasive procedures.
So you could go out siguro after how many days lang, no? Pwede ka nang
Yes, in a matter of 3,
mag-socialize.
4 days. Kung hindi ka rin nga magaan right after the procedure, you could go malling if you want. Kung hindi ka naman masyadong issue sa inyo.
Galing, no? Ang galing ng
masyadong-
technology. Oo.
We're using actually very fine needle na mas maliit pa dun sa pang baby. Okay? So specially designed needle para lang maipasok natin yung thread, medical grade thread or
medical
material.
grade. Ito, medical grade.
Yes. Para na sa ganun.
And natutunaw ang
Yes, yes.
natutunaw to.
That's good.
Going back lang kanina sa nose lift, very common na question ito is kailan pwede magpa-opera ang isang pasyente? What age? And may limit ba? Kunyari, 73 years old, pwede pa ba daw siya magpa-nose lift? What can you say about that?
Basta't full grown na yung pasyente, yung when say full grown yung bones niya
Bone
fully
development.
developed na siya, no?
Okay.
So normally 18 years old talaga dapat yan, pero merong as young as 16, 17 depending on the assessment of the doctor.
Pwede na.
Yes.
Yes,
oo.
okay.
Okay, we have a texter from cell phone number 1135, Dr. Lau.
Good day. Magkano po ang budget kapag magpapa-plastic surgery sa inyo?
Kano to ang budget?
Medyo broad yun.
broad yun no?
Kasi walang procedure na binanggit
Sa ngayon, very broad yung question. But the
Ano
thing
yung
is,
mahilig mo sabihin dyan, Dr. Cenica? Kapresyo lang ng isa.
ano siyang cellphone eh.
Cellphone.
Para bumili ka na lang, pwede kang at the price of a cellular phone, you can
Pwede
undergo
mo muna
the
siguro
procedure,
ipagpalit yung cellphone sa procedure.
Yeah.
No?
The good thing with cosmetic surgery right now, mostly sabi nga ni Dr. Dalisay, is outpatient. So that means na kapag kasi na ang isang procedure ay, let's say, na hospital yung pasyente, less than at least mga 60% of whatever the price of the gross price of a procedure. So, sa ngayon, mas mababa na ngayon because some of this procedure that been mentioned by Dr. Dalisay is that mostly are clinic-based procedure. So, mas less po ang
Price na.
price. No? So, siguro kung gusto niyo malinawan ng price later, we will give you the
Kung saan po makikita
contact
si-
first
yeah.
numbers of Dr. Dalisay. Okay, we have another texter from cell phone number ending at 4810.
Yes.
Dr. Dalisay. Dr. Blau.
Doc, may peklat po ako sa mukha and ano pong procedure ang gagawin para mawala po ito? Meron po bang natural solution instead? Kabangkalan City.
Saan yun?
Yeah.
Ang layo Mukhang,
Sige,
sige, Dr. Dalisay.
scar and
Meron
ano yung
dong
natural
scar, ano
solution?
yung pinakamadali siguro o the natural solution
Very
for that?
popular ngayon and very effective naman din talaga yung tinatawag natin CO2 fractional laser.
CO2
CO2
fractional
fractional.
laser.
Well, naka-base lang ako dun sa scar na sinasabi niya dahil ang imagination ko without seeing her, yung the common na pinipresent sa atin.
Pimple
Kasi
marks,
baka
acne
mamaya yung
scars.
scar naman natin malayo dun sa pinag-uusapan natin. It could be scar revision. For that matter, dapat surgery yon. Pero yung
Pero
most
most
common
common acne
type
scars.
ng scar sa face, it could be addressed with CO2 laser.
Right.
Dun sa sinasabi naman niya na natural way, we could also extract some blood para ma-process natin, PRP, counting stem cells, para
PRP.
conjunction, para mas maganda
Combination therapy.
Yes,
PRP.
combination with
For the televiewers, ang PRP po is the
Platelet-rich
plasma.
It's a natural way. Sabi nga, natural solution.
It's
Tama.
natural,
Autologous
Dr.
po
Dalisay,
yun.
no?
Autologous. Kasi sa
Autologous.
inyo po galing
That means
yun.
galing sa
Yes, sa
mismo
inyo po
sa
galing.
pasyente. Anyway, later in our second segment, as I have said, that we will be discussing all about this electronic chair massage or this mga high-tech gadgets, no? And together with us later will be the sales manager of Hero Products, and we will be demonstrating live here in the Global News Network, and we will be answering some of your questions later on together with Dr. Dalisay and of course our guest from the salesperson of Hero Products.
Electronics.
Okay, we'll be right back when WhatsApp Talk returns.
Natural look nose lift, cleavage by breast augmentation, curves by liposuction, non-surgical treatment of varicose veins. Janssen Cosmetic Surgery by Dr. John Cenica.